and welcome everyone. I'm Rotaract Hasna Minsarah from Rotaract Club, Faculty of Medicine, Sabaragamuwa University of Sri Lanka. I will be the moderator for today. And once again, I warmly welcome all of you. Sexual and reproductive health is kind of personal subject which many people may have trouble finding or asking for accurate information. And also sometimes these issues are not addressed openly. Also, we have realized the lack of comprehensive sexuality education within the school curriculum in Sri Lanka. It's obvious that youth needs access to accurate information and they must be informed, empowered regarding this. And that is exactly where Saubhagya comes in. Rotaract Club of Faculty of Medicine, Sabaragamuwa University of Sri Lanka and Colombo West together initiated Saubhagya to educate young people on this topic. We are equipped to empower you to take charge of your own reproductive and sexual health. To talk about these important matters, we have our guest speaker today. With utmost honor and pleasure that I introduce our guest speaker, Dr. Oshadhi Nallperuma, Acting Head, Lecturer, Department of Obstetrics and Gynaecology, Faculty of Medicine, Sabaragamuwa University of Sri Lanka. Welcome you on board, ma'am.
Thank you, Hasna. And good morning to all of you. And thank you for giving me this opportunity to the Rotaract Club. I think we'll have a good discussion today. So
yeah, happy to have you, ma'am. So in the first phase of Saubhagya, we intend to cover the female reproductive health, menstrual cycle, and associated diseases, plus to negate popular taboos and myths surrounding female reproductive health. And just a little nudge before we get started, we'd love to hear from you as well. We will have time for all your burning questions at the end. So you can unmute yourself and ask, or you can send them via the anonymous Google form we put in the chat box. Okay, without further ado, let's get rolling. I would like to call upon Dr. Oshadhi to continue the session, and it's over to you, ma'am.
Thank you, Hasna. So let me share my screen with you. Good. So let's talk about menstruation and some things related to that today. So I have received some questions and we'll be receiving more questions at the end of the discussion. I believe the participants are about the age of 16. Am I right? Is there anyone who is below 16? No? So I assume you all are grown-ups to have this kind of a chat. So because we are a little discussing adult stuff today, but in other countries, these are actually taught in primary schools. But as our country is little different and little backwards towards reproductive education, I think we need at least this kind of initiative to have you to distribute this knowledge or to have you empowered with this kind of knowledge. So let's move on. So this is just a little brief insight into menstruation and related problems. So as Hasna introduced, I'm Dr. Oshadhi Nallperuma. I'm a specialist in obstetrics and gynecology and currently attached to Faculty of Medicine Sabaragamuwa. So let's talk about before menstruation, how it happens, right? So when you all are, I mean, there may be boys and girls, both are listening to this discussion, but I would be talking about girls within the discussion. It doesn't mean that we don't need boys, right? It just means that discussion is focused on female reproductive system. So this kind of small girls, when you are in about your grade 7, 8, 9 onwards, you will be changing into adulthood. So it is a transitional period where you find a lot of new things. So how does this happen and what happens during this period? So this in medicine, we call it puberty. Puberty, it's a term. But it's not only in our tradition, what we mainly come across is the one part of puberty, which we call menarche. So menarche in Sinhala, if we say, we call it malwara වෙනවා. එහෙම නැත්නම් අපි කියනවා පළවෙනි වතාවට ඔසප් වෙනවා. Menstruation we call in Sinhala ඔසප් වෙනවා. පළවෙනි වතාවට ඔසප් වෙනවා. නැත්නම් ආර්තවය පළවෙනි වතාවට වෙනවා. මාශුද්ධිය කියලා කියනවා. එහෙම නැතුව සරල භාෂාවෙන් කිව්වොත් ඔයාලා නම් කියනවා ඇත්තේ big girl කෙනෙක් වෙනවා. or we call it attend වෙනවා. ගොඩාක්ම සරල කරලා කිව්වොත් කියනවා ජම්බු ගහෙන් වැටෙනවා කියලා. So මොකද්ද මේ වෙන්නේ? So what happens? That is the first thing. So you will understand during this transition period, the girl who loved the doll, you were so fond of your dolls, you will change your interest more into the boys, right? It's very natural, and that is the way it is. That's one part of your transition into adulthood. So you will see some changes in your body. So you have already witnessed these things if you have already grown up into your adulthood. So there will be growth of hair, especially in axilla, which we call the armpit. So you see now this girl is growing some hair. So when you're very small, no hair, now there's some growing hair in your armpits. And it's not only armpits, there will be hair growing in your pubic region. And also you see some other changes like this. So there's a growth of hair in your pubic region, and there will be growing of external genitalia, right? So the things which needed in adulthood started to grow during this time. Also, the breast development is seen. So this is something you start, initially you might feel some discomfort because it's a very new thing, and you will have to start wearing underwear, which we call a bra. So it's a new thing for you, and you will feel it's like your chest is tight and you can't breathe. But after some time, you will get used to it. So this is breast development, just depending on the age. So you can see there are different stages, which I'm not planning to go into details. So there would be development of breasts. And then not only the hair and the breast, you will see the change in your body, the whole body. The body proportions change. You will be growing up. There'll be a growth spurt. And this is the time where classically the girls are taller than the boys. So we all know in adults, the adult male is taller than an adult female. But during this time, as the boys get their puberty a little late than the girls, so the girls will be taller in classes. You will see you are taller than the boys. So not only that, you will see the body proportions changing. So this is what we call Ingasunga gata hakamitina riya sakawan pululukula ono hadenne oi kaleta. So you can see there's nice V shape, or we call it hourglass shape, is building up. The hips are broadening, the breasts are enlarging, and the chest is broadening. So these broaden when the hip remain in the same size. So that's why you get this hourglass shape. So these are necessary for the reproduction, to carry a baby and to provide nutrition to the baby. You need these things. So that's why these parts are changing. Then one day, in a day that you don't know, in a day that you can't plan, in unpredicted day, you will have your first bleed. So then it may be something, some time which is comfortable for you. You're at home sleeping, or maybe it's very inconvenient time like you're at school. So a little bit difficult to predict when it happens exactly. But then when it happens, so many things will start to change, because there's a social role or social uh, importance given to this event. In ancient history, it was important to give this event some significance, because when a girl attained menarche, it was believed that girl is suitable to bear a child. So that you needed to announce that to the rest of the society. Then only the girl will have a partner. But nowadays, the things are a little different, because we don't get our girls, children married as soon as they attain menarche, right? So the traditions have changed. The time of marriage has gone up to 25 plus. So you will have your menarche somewhere in about 13, 14. So at this point, we don't want actually that kind of publicity or draw attention into menarche. But it takes time for the traditions to change. So until that, we'll have to bear with it. So you may not like it sometimes, right? Because there are so many taboos and this and that. So to talk about menstruation, let's see how it comes. So menstruation is something happening cyclically. So this is the part of internal genitalia, or we call it anatomy. So these are the stuff a girl child or a woman would have. This is the part is called uterus or the womb. So you can see there are two tubes attached to the womb, which we call fallopian tubes. And then there are two ovaries at the side. And this part, cervix, is the neck of the womb, which get connected into a tube-like structure, which we call vagina. And then there's a vaginal orifice. So අපි සිංහලෙන් කියනවා නම් මේ තියෙන ගර්භාෂය. ඊට පස්සේ තියෙනවා fallopian නාල දෙකක්. ඩිම්බකෝෂ දෙකක් තියෙනවා. ගර්භාෂයේ තියෙනවා ගර්භාෂයේ neck එක බෙල්ල ගෙල හරිය. අපි cervix කියලා කියනවා. ඊළඟට තියෙනවා යෝනි මාර්ගය. So the blood which comes out as menstruation is the blood coming from this uterus. So this part, the endometrium, is the inner lining of the womb. So this inner lining will be shedded once a month, roughly once a month, in an adult woman. So this blood comes out from the neck of the womb to the vagina and comes out from the vaginal orifice. So that's what we recognize as the menstruation. So let's see how it happens. So this is where it comes out from. So if you haven't actually checked your external genitalia by now, I advise you, as soon as this discussion is over, take a mirror, go to the bathroom and look at yourself, right? It's not a crime to look at yourself. You should look at yourself and see what are the parts in your body, right? So these are the same parts, just like you have two eyes, two arms, two legs, one mouth, one nose. Just like that, you have a pubic region. So this hairy region, we call it pubic mons pubis. And then either side of the mons pubis, there are two lips-like structures. We call it labia majora. අපි සිංහලෙන් කියන යෝනි තොල් කියලා මේවට. එළිය දෙකක් තියෙනවා. ඇතුලේ තව චූටි දෙකක් තියෙනවා, which we call labia majora and labia minora. So at the top, there's a thing called clitoris. So this is something which is similar to the penis or the genital male main reproductive organ, the penis. So it's something similar to the clitoris. We are getting some background noise. Yes, thank you. So it is something very similar to that. So in Sinhala, we call it Bagamani. I know the name is little difficult name, but you can use the name clitoris. So beneath that, there's urethral opening. That is where the urine comes out, right, from the bladder. So bladder is somewhere here, which you can't see in this picture because it's from, you look at from outward. So this is what you see when you part your legs. And this region, which is in between this labia majora, we call it labia minora, we call it vestibule. And then there's vaginal opening. So if you are very interested in the hymen, kanya pataliya gan danaganna onna onno oka tiyenne menna me hari. Harida yoni marge kelawara. So it's not present in all of you. It's not present in the same manner in every person. It can be different. And there can be so many natural variations, and some will not have a hymen naturally, right? It's not an important organ. It's something which should go, but it's just there. It's like the appendix, not a necessary part, just there. And it causes a lot of social problems, especially in countries like ours, where there's so many cultural taboos. So this is far away is the anus, where the bowel comes out. So the menstrual blood, which was there, which comes out from the uterus, comes to the neck of the womb, comes out from the vagina, and comes out from here. Okay, so that is the internal and external appearance in a female. So how do you menstruate and what is menstruation? So how does it happen in this kind of a cyclical manner? So this happens because of ovulation. So ovulation is the process where an egg is produced from the ovary. So when this egg, the yellow color one is the egg, is released from the ovary every month, the egg will go from this fallopian tube and goes into the uterus and goes away. So by this time, if a sperm comes in from this way, the sperm will meet the ova somewhere here and a baby will start to grow. So if the sperm is not coming, there won't be any babies having any babies. So the egg will be just die within 24 hours, right? So how does this ovulation occurs? Now, I know it's a little complicated picture, but we'll go from one phase to the other. So there are two phases of a menstrual cycle, mainly two phases. So one phase, we call it follicular phase. The other phase, we call it luteal phase. In this so-called follicular phase, now let's think your cycle is 28 days, right? 1 month or 28 days. So first 14 days would be the follicular phase. The next 14 days would be the luteal phase. So when I call day 1, I mean the first day of the menses, right? When you start to bleed, the first day of your period is called the day 1. So from day 1, so this is the endometrium, the inner lining of the womb. So you can see it's coming out from the womb. There's menstruation, the bleeding happens. So during this time, a new egg will start to grow in the ovary. So it needs time to grow, and that growing of the egg will happen for 14 days. So during this time, that menstruation will be finished by 3 to 5 days, and the endometrium, the inner lining of the womb, will start to grow. So it will grow to satisfactory level by the midday or the day 14. So by this time, now egg is mature enough and it will be released. So you can see here the egg is coming out from the ovary by the day 14. So when the egg comes out, it will be picked up and taken into the tube. That moment, the remaining parts of the egg or we call it the outer covering of the egg, which is not released, will change and make something called corpus luteum, right? අපි කියනවා සිංහලෙන් ඔයාලා bioscience කරනවා නම් මේකට අපි කියනවා පීත දේහය කියලා. Corpus luteum. We call it in luteum means it's yellow in color. So same name, right? Pita dehe. So yellow body. So this one will give another hormone which we call progesterone. So this growing follicle will give another hormone called estrogen to grow this endometrium or the inner lining. So in the next half, what happens is the corpus luteum will give progesterone and will maintain this inner lining of the womb, because the egg wants to meet and sperm. So the body doesn't know whether the sperm has come or not. So to give some chance for the baby to grow, the corpus luteum will give some hormones and maintain this inner lining. But if a sperm has not come, if the baby is not growing, the corpus luteum will start to die. Because if the baby is growing, there's another hormone which comes and say the corpus luteum to stay alive. But as that hormone is not coming, the corpus luteum start to die. So when it dies, the progesterone doesn't come. So the inner lining of the womb will start to die also. So this dying inner lining will start to go away. And when it goes away, there are some blood vessels which get breaks and there will be some bleeding. So that is what you get as menstruation on day 28. So that's the physiological basis of menstruation. So these are just the hormones that I told you about. So there are mainly 4 hormones. So these two, the big names, the FSH and LH, if you do bioscience, you are aware this is called follicular stimulating hormone, and this is called luteinizing hormone. So these are coming from the part of the brain which we call pituitary. මොලේ තියෙන pituitary කියන ග්‍රන්ථියෙන් තමයි මේ දෙක එවන්නේ. ඒ දෙන්න ඇවිල්ලා මේ පැත්තේ මේ follicles වලට support කරනවා හැදෙන්න. එතකොට follicles වලින් තමයි මේගොල්ලෝ හැදෙන්නේ. මේ මුල් half එකේ තියෙන මේ follicle grow වෙන egg එකෙන් එවනවා estrogen කියන hormone එක. දෙවෙනි half එකේ තියෙන grow වෙන මේවායින් එවන්නේ progesterone කියන එක. So estrogen වලින් ඇතුලේ බිත්තිය හදලා දෙනවා. progesterone වලින් ඒ හදපු බිත්තිය තියාගෙන ඉන්නවා. මොකටද තියාගෙන ඉන්නේ? බබෙක් හැදුනොත් තැම්පත් කරගන්න පුළුවන් වෙන්නේ. හැබැයි බබෙක් හැදිලා නැත්තම් බබෙක් හැදුනොත් තමයි මෙන්න මේ corpus luteum කියන පීත දේහය තියාගන්න අවශ්‍ය කරන හෝමෝන් එක එන්නේ. අපි කියනවා HCG කියලා එකක්. ඒතකොට බබෙක් හැදිලා නැත්තම් මේක තියාගන්න ඕන කරන සිග්නල් එක එන්නේ නැහැ. ඒතකොට මෙයා මැරිලා යනවා. එයා මැරිලා යනකොට ප්‍රොජෙස්ටරෝන් නැති වෙලා යනවා මේ නැති වෙලා යනවා. එතකොට මෙන්න මේ බිත්තිය තියාගන්න බැරුව කැඩිලා යනවා. That we call it menstruation. ඔකට තමයි කියන්නේ. So in a human, there's it takes roughly about 1 month. So then this is a very common question. What is normal? What is normal menstruation? What is the duration? What is the frequency? Right? So for an adult or woman, the menstruation, although we call it 28, it can change from 24 to 38, right? So one girl can have her cycles each 24 days, while the other one would have every 38 days. Both are normal, right? Doesn't necessarily mean you have to menstruate every 28 days. But if you are menstruating more frequently than 24, yes, then we are worried. If you are menstruating less frequently than 38, then we are worried. But otherwise, it's normal. Then there are things like this, right? You have 1 month, it's 28 days. Next month, it's 30 days. Again, next month, 29 days. Next month, 33 days. So is it different? Is it an abnormality? The answer is no. You can have difference between your shortest cycle to longest cycle about a week, right? It's actually 8 days difference is accepted. So you can remember, so even 1 week's difference between your shortest cycle to your longest cycle is normal. That was 28ටම menses හැදෙන්න කියලා එකක් නැහැ. 24 ඉඳන් 38 වෙනකම් normal. ඒක දවසක් දෙකක් එහාට වෙන්න නෙමෙයි සතියක් එහාට වුණත් එහාට මෙහාට වුණත් අපි කියන්නේ ඒකට normal කියලා. Then other thing is how many days? Another big question. How many days is normal? So some people are worried when you have only menstruation for 1 day, 2 days. Is it normal? Yes. If you menstruate 1 day, be happy that you have menstruation 1 day. The problem is only for 1 day, so be happy. You menstruate 5 days, good. Be happy. It's 5 days. That is normal for you. It can be normal even up to 1 week, right? Again, for 8 days, it can be normal. There's nothing called you have to bleed this much. You need to bleed for 5 pads. You have to bleed for 1 packet of pads. Or you need to bleed 2 packets of pad. This much is this thing, this much is that thing. No. So we consider it normal up to about a week, right? So difference can be a week, bleeding can be for week. So then there are symptoms associated with menstruation where you worried whether is it normal. So having mild pain and discomfort, especially on the first day or just before menstruation, is normal. And it's very common in young adults, like teenagers like you. It's very common to have some pain, but you should make sure it's a pain which can be which is bearable, right? Not something that you can't go to school. So it should be something that you can bear, or maybe with just a small painkiller like paracetamol. So you can cope up with your work. And it should go away during the time of menstruation. If it is outlasting the periods, then it can be abnormal. And there are symptoms like irritability. You might feel little weight gain, bloated up sensation. You might feel agitated. So those are common, especially just before menstruation. The breast tenderness, you will feel the breasts are very sensitive, mild painful. So those are because of the hormones which are changing at that time. And those are normal things, right? Those are normal things. You will feel them more when you start to menstruate, right? But when you get used to the things in about 5 to 10 years, those things will, most of the things will disappear. So this is what I told you about the regularity, right? So in your calendar, you may see, okay, it didn't come today, not today, not today. So how many days? How many days? It can be, varies up to 7 days, right? So again, it can be 24 to 38, can be normal. Right? One can have 24 days, every 24 days, one can have every 38 days. Is it too heavy? Right? So sometimes we get the answer, it's like flooding, right? Now this is what we call flooding. You have to think when you use the term flooding, is it real flooding? So this is how the flooding would look like, right? If you have flooding, remember your other people in your house should be wearing very short clothes and be going ahead with boats, right? That's what we call flooding. Is it like that? Is it that heavy? How do you know? How do I know whether it's too heavy or not? Yes. So these are the things or the red flags you should be worried. So if you bleed too much in your every cycle, you will lose too much iron from your body. The hemoglobin levels will go away, right? So when the hemoglobin levels goes away or goes low, you will get something called anemia. So anemia means there's less blood in your circulation, right? So there are some features. So if you are studying, you will feel you are tired always. You can't study, you feel very sleepy. And sometimes you will be having shortness of breath. That means you need to stop and you feel hungry for air. You feel hungry for air. So that is called shortness of breath. Then this happens when you have very low counts, which is not very common with heavy bleed. But this can happen. Pika is a kind of thing that you feel like eating rice and all. In Sinhala we call pandu or hal kanna hitenne. That is because low iron stores. And when we examine, we see you are very pale. So pallor means you feel you are very, very pale. It's not fairness, it's pale. You will feel you look like a half sheet, right? Then the cold peripheries, again, the hemoglobin should be very low to have this kind of sign. It's not very common with heavy bleeds. And this one, so if you find difficult to attend your school or any other events, maybe to your tuition class, or maybe if you are doing some sports that you can't go to your sport practices, but if your normal life get disturbed because of menstruation, that means you should be seeing a doctor, right? And then if you bleed too much, remember there will be passage of clots. Clots means blood clots. Menses වෙනකොට කැට කැට යන්න පුළුවන්. ලේ කැට කැට යන්න පුළුවන්. ලේ කැට කැට යනවා කියන්නේ ගොඩක් bleed වෙන එකේ එක sign එකක්. So passage of clots. Then double protection. So one pad is not enough. So you wear one pad and over that pad you wear another pad. So that is another sign to say you have too much bleeding. Then, yes, I told you, when you have pain outlasting the period, let's say you end your period on day 5, you have pain on day 6, you have pain on day 7, then you should visit a doctor. And if your periods are going beyond those normal range I told you, so happening more frequently than 24 days, less frequently than 38 days, regularity is disturbed, more than 1 week difference is there between your shortest and longest, or you bleed for more than 7 days, right? Then you should be visiting a doctor. Yes, so that's time to visit your doctor. The doctor can be a general practitioner or the family doctor that you are very friendly with. Or you can go to a gynecologist like us, or you can visit the government clinic, or you can channel and go to the private sector, whatever. If you have those red flags, it's time to meet your doctor. So what would the doctor do? So first thing, would listen to you and take a history, right? Then she would examine you just to see the basics, whether you have bled too much and other things, right? Then we might, if we think it's necessary, we might run some blood tests like a check for hemoglobin level, a full blood count. And then sometimes if we find it's necessary, we would offer you an ultrasound scan. For young girls like you, we don't do scan from the vaginal route. So we do transabdominally. So through your tummy, we would apply a little gel here and put this ultrasound probe and look at your tummy from the ultrasound screen to see whether your ovaries are okay, whether your womb is okay, is there anything abnormal there. So most of the time in young girls, we don't find any abnormality most of the time, just normal. So then these are common methods of management. So she might say, it's all normal, not to worry, or you do this thing and that thing, this is what to expect. Or she might give some pills. So it may be simple analgesics like paracetamol, or it can be a hormonal contraceptive pill to put your cycles regular, to make your bleeding less and to ease your pain. Or it may be some lifestyle changes, like do some exercise, eat some healthy diet. So it can vary depending on your condition. Okay. So before going to the next subtopic, Do you know what this is? Anyone who has seen this before? So this is a photo from India. It is called Yoni temple, right? It's the same Yoni that we use. We call Yoni up Yoni Marge Kyan vagina. So it's the same Yoni, right? So they believe some goddess Sati or someone, or the Kamakya goddess Yoni has fallen at this on this rock. So they have built a temple. So because of some natural phenomena, once in a year with the monsoon, maybe because of the termite, or maybe because of some algae, or maybe because of some ferric oxidation, however, the natural phenomena, the rock is producing some red colored blood in one season, right? So, and it has this classical shape of a vaginal orifice. So it is believed that the goddess is bleeding. So they have built the temple, and once a year when the goddess bleeds, they have a big festival. I just put this to show how there are so many traditions or taboos and things, myths built on this menstruation. In some cultures, in ancient cultures, it is considered a holy thing or spiritual thing, the menstruation. In some Greek and Rome ancient cultures, they have used to drink menstrual blood, thinking it can heal most of the diseases, right? So the same thing, in some cultures, it is believed very unclean. So the women who are menstruating are not allowed to go out and not allowed to have a bath in public places. So there are some taboos in some this thing. In some way, it is treated in a very holy manner or spiritual thing. But you have to remember, the menstruation is a biologic process. It is no different than breathing or your heart beating or micturating, right? Or eating. It's no different to any of those natural things. It's just a natural thing. Only difference is it doesn't happen at the time of the birth, right? So you breathe from the birth, your heart working even before birth. So you urinate even before birth. You open your bowel after birth. So those things we witness from the birth. But menstruation does not happen from the birth. So that may be one reason why it is considered so traditional, or with a lot of traditional taboos. So, okay, let's move on to the next topic. Yes, so there were so many questions on this subject, so we thought we would touch upon this. What is PCOS? PCOS is a common condition. We call it polycystic ovarian syndrome. So it affects actually about 10 to 15% of the population. So it's a very common thing. And as Asians, we are kind of predisposed to this condition, and there are a lot of reasons for that. And nowadays we see it very commonly in young girls. So what are the clinical features of polycystic ovarian syndrome? Excess body hair is a common thing. So body hair doesn't always mean your facial hair. It can be hair in the back, thighs, a breast, anywhere. But it's classically, the difference is it's male pattern body hair. And there will be acne, not always, but acne. And then the menstruation is irregular and infrequent. So I told you up to 38, it could be normal, but when you have polycystic ovarian syndrome, right, your cycles will be more infrequent than 38 days. And there will be irregular periods. And commonly it is associated with weight gain And you will see this kind of truncal obesity. We call it truncal obesity. So where you have a lot of central fat, the tummy, බණ්ඩි ගෙඩියක් එන්න පුළුවන්. මෙන්න මේ වගේ. අපි කියනවා truncal obesity කියලා. එතකොට polycystic ovarian syndrome. Syndrome is collection of features, right? Where we don't know exact mechanism to call it a disease. We call it a syndrome because we are talking about collection of features. So these are what you come across as symptoms or the complaints. So what happens? Now this is another thing which can be associated. This is called acanthosis nigricans. This is not classically a feature of polycystic ovarian syndrome, but it's a feature of insulin resistance. It can be associated with polycystic ovarian syndrome, or it can be associated just with diabetes mellitus. So it is the dark color pigmentation in the neck, the front and the back of the neck, and also in the armpits. So this is, I know, a very complicated slide. So I'll just try to simplify it for you. So what happens in polycystic ovarian syndrome is one thing. Now I told you there are two hormones coming from the pituitary, from the brain. This is the pituitary. So FSH and LH. So the levels of these hormones are deranged now. So they don't come in the fashion they should come to bring about a normal menstruation. So that's one problem. So what happens when you don't have properly regulated FSH and LH is your ovary will not be able to produce an ova, an egg, at the day 14. So no egg is coming on day 14 because egg is not matured because of this problem with FSH and LH. At the same time, there is something called insulin resistance. The word resistance means, now when the insulin gives a command, the body should listen to insulin. But when you have this problem, the body is not listening to what insulin says. When insulin says, okay, lipids, you're going to cells, no, they are not listening. They are outside in the blood. So when insulin says liver produce some sex hormone binding globulin, which is called SHBG, so where the testosterone will be kept bound, the liver is not listening. Liver is not producing enough sex hormone binding globulin. So not listening to insulin. So because of that, there will be less transport hormone protein of the testosterone. In girls also there are some testosterone. If you are surprised, there is some natural level. So they are bound. So they are bound and transported in blood, right? They are not isolated. So the testosterone brings its action if it is free. So naturally, there's something called sex hormone binding globulin produced from the liver, and it keeps bound like this. It's like in the packet. It's not released. So what happens in the PCOS, because of this problem with insulin, the liver is producing less amount of sex hormone binding globulin. So more testosterone will be free. So there will be more action of male hormones. That's why you have things like acne and extra hair. So the same time, so see, you can have the excess hair, we call hirsutism in medicine. Acne is the pimples that you know. So that happens because there's more free androgen. Androgens is the male hormones, right? Things like testosterone. So what happens in the same time, because the pancreas is not producing, increasing insulin secretion, and because the adipose tissue, the fat tissue is also not listening to insulin, there will be more lipids in circulation. The insulin තමයි fat ඇඟේ තියෙන blood එකේ තියෙන fat ගිහිල්ලා fat tissue එක ඇතුළට දාන්නේ. Fat tissue කියලා තියෙන්නේ ඇඟේ හැමතැනම තෙල් කියලා තියෙන්නේ. ඔය තෙල් එකට fat එක store කරලා තියන්නේ insulin. එතකොට insulin කියන දේ අහන්න නැති වුණාම fat එක blood එකේ ඔහේ තියෙනවා. යන්නේ නැහැ. එතකොට ඔන්නගොල්ලන්ගේ ඇඟේ fat වැඩි වෙනවා. ඊට පස්සේ glucose ඇතුළට දාන්නේ කවුද? insulin. ඒතර glucose ඇතුළට දාන්න cells කියන දේ අහන්නේ නැහැ. ඒතර glucose blood වල වැඩි වෙනවා. ඔන්න diabetes වෙනවා. ඊට පස්සේ sex hormone binding globulin කියලා එකක් තියෙනවා. ඔය පිරිමි හෝමෝන් ටික අල්ලලා බැඳලා තියාගන්න එයා. එයා හදන liver එකේ. ඒතර ඉන්සියුලින් කියන දේ අහන ලියන liver එක අහන්න නැති හින්දා එයා හැදෙන්නේ නැහැ. ඒතර ඔන්න පිරිමි හෝමෝන් ඇඟේ වැඩි වෙනවා. ඒතර මොකද වෙන්නේ? රෝම එනවා. පිම්පල්ස් එනවා. අනිත් පැත්තට දැන් මොකද උනේ? දැන් මේ FSH ප්‍රශ්නේ හින්දා හරියට ඩිම්බේ මෝරන්නේ. ඒතර ඩිම්බයක් හරියට මෝරලා පිට වෙන්නේ නැහැ. ඔන්න ඔය ප්‍රශ්න ටික තමයි මේ PCOS තියෙන කට්ටියට තියෙන්නේ. අපි බලමුකෝ ඒවයි මොකද වෙන්නේ කියලා. So what will happen if I don't ovulate? So what happens now? I told you, now every 14 days there will be a release of ova. So when the FSH is not coming in the regulatory fashion, there won't be the ova will not mature. So in this picture, this is an ultrasound picture of the ovary. This is classically in a patient with PCOS. See, these tiny black color ones are ova. So these are lots of tiny ova here. They have not matured, right? So they are just collected in the periphery of the ovary. Ovary එකේ වටේම නිකන් මුතු මාලයක් අමුණලා වගේ ඩිම්බ තියෙනවා. හැබැයි එකක්වත් හරියට මෝරලා පිට වෙලා නැහැ. පිට වුණ නැති වුණොත් මොකද වෙන්නේ? So this is again just to remind you, see, now if the FSH and LH are not coming in a coordinated fashion, right, this maturing thing doesn't happen. So if the ova is not released, you will not, I told you when the ova released only, the inner lining of the womb goes from this phase to this phase. So what happens in this phase? They have a growing of the inner lining. This phase, there would be the maintenance of the inner lining. So when there's no ovulation, the inner lining will not move from this phase to this luteal phase. So there will, the uterus will, the womb will be keep on growing, but not having menstruation. So that's why you get prolonged infrequent cycle. Menstruation is not happening because ova is not released on the proper day. So after when the end of the inner lining is grown too much, one fine day, it will just get shed off and start to bleed. So it happens in about, it can happen in 2 months, or it can happen in 3 months, or maybe in 4 months. So you will have an irregular cycle, infrequent cycle, which cannot be predicted. And because now the inner lining has grown too much, when you bleed with PCOS, you will bleed for a long time, right? The bleeding will be heavy, there will be clots, and it will be prolonged bleeding. Most of the time, that's the nature. And when you pass clots, you might feel pain, right? There will be painful periods. So these are some things that you have when the male hormones are elevated. I told you the excess body hair you can see. So it can be in chin, body, any part of the body, right? So these are the classic male type hair that you get. And the acne, pimples, and see loss of hair. This is we call male pattern hair loss. පිරිමියාගේ කොණ්ඩේ යන විදිහට තමයි කොණ්ඩේ යන්නේ. පිරිමි කට්ටිය කාලේ දැකලා තියෙනවද තාත්තලාගේ එහෙම කොණ්ඩේ යන්න පටන් ගන්න මේ ටෙම්පල්ස් වලින්. ඒකනේ මට ටෙම්පල්ස් කියන්නේ. මේ පන්සල් යන්න මතක් කරන්නනේ ඒවයි කොණ්ඩේ යන්නේ. ඒවා පේන්න ගන්නකොට පන්සල් යන්නේ කියන එකනේ ටෙම්පල්ස් කියලා දාලා තියෙන්නේ. Not the temple, that our temple. So that means you are getting old. So when your male hormones goes high, there will be hair loss like this. So it's a troublesome thing when you are schooling or when you are having your teen life, young life, when you are losing hair. It's a very troublesome symptom. What are the other risks of this condition? So other than having these things, if your ova are not maturing and going out, obviously you will not be able to have kids, right? The baby, to have a baby, you need to have eggs coming out. So when there's no eggs, no babies. And I told you they have some problem with their insulin. So the sugars will go high in your blood, which leads to type 2 diabetes mellitus. Obesity, that is the problem of having too much fat in your body, because again, same time, because problem, the fat tissue is not listening to insulin, there will be fat everywhere, leading to this obesity. And when there's fat and sugar circulating, you will have cardiovascular problems. That means the heart will be sick. You will get heart attacks, and you will get things like strokes, where you get one part of your body paralyzing. These things can come in later in your life, right? Just because you have PCOS today, you will not get a heart attack tomorrow. But when you have this kind of problems for a long time, maybe 10 years, 20 years, 30 years, when you are at the age of 40, 50, you will have this problem, right? Doesn't necessarily mean you will get heart attacks tomorrow, okay? And endometrial cancer is the cancer of inner lining of the womb. Now, I told you when there's no ovulation, the inner lining will keep on growing. When something keeps on growing, it can build into a cancer, right? You have heard the word cancer, right? So there can be build of cancer. This again will happen after some years, right? Not when you're in your 20s, maybe not at 30s, but maybe in 40s, 50s. If you continue to have this problem, you can end up having a cancer. And sometimes with these problems, there are problems with your happiness. You will feel depressed, and there can be problems associated with that. So how can we manage this? What can we do, right? There are things that we can do. So these are two things that you all can do and actually reverse this condition and bring it to a near normal situation. Dieting and exercise. Dieting and exercise. These are the two key things which can actually alleviate and completely settle this problem of PCOS. So look at this diet plate, right? So these are the starch, fish tethionema, carbohydrates, bhat, pang, piti, roti, araka meka, piti waling hada koma tika make. So you take only 1/3 of your meal from these starchy products, right? Carbohydrates 1/3. And when you take carbohydrates, try to take the complex one, right? So there are different carbs. So example, a bread would be simple carbs. When you eat, you feel, right? They're very easily digestible, bread. But if you eat rice, especially red rice and parboiled rice, tambapuhal kila kiyan, those things, and kurakkang, those things are difficult to digest, and it takes time to take sugar from these carbs. So they are healthy food. But anyway, make sure that you don't take 1/3 of your plate from carbs. And 1/3, make sure you get greeny stuff, fruits, vegetables, green leaves, and those things, 1/3. You can even go more than 1/3 if you are taking green leaves, right? You can eat a whole plate of green leaves. And make sure you have 1/3 of proteins and fats, right? Small amount for these fats and these very high sugar ones, right? The proteins, you need proteins. Don't cut down when you're dieting. Never cut down on your proteins, right? If you cut down on your proteins when you are dieting, your muscle wasting will be there, right? Your muscles need proteins. So don't diet by cutting down on your protein. So eat a big slice of fish. Malu kallai, mas kallai, bittara yatarin epa diet karanti. Eka badina thel tika atarin. So boil it and take it, right? So don't give up on the proteins. You need proteins. But try to cut down on the things like these. The chocolate, sugars, we call empty calories, right? You get just bunch of calories, but without much nutrients. We call empty calories. Cut down on them. Cut down on deep fried ones where you get very unhealthy fat. And exercise. So we recommend at least 30 minutes of exercise, right? 30 minutes per day for 5 days per week, minimum. The exercise doesn't mean weight bearing exercise, right? There should be aerobic exercise. Aerobic කියන්නේ ඔයාලට දාඩිය දාලා high-end husma වැටෙන exercise තියෙන අන්න ඒවා. Those exercises are the ones which increase your cardiac work and it will burn your fat, right? So just walking is not enough. You have to run, right? Just walk, not walking, you have to run. And you can do cycling, you can play, right? Play badminton, play ball, play cricket, whatever, right? Play. And swimming, things like that, right? We call aerobic exercise, where you feel you are breathing fast, your heart is working fast, that kind of exercise. So minimum 30 minutes, 5 days per week, minimum. You can go up from there, any level. So if you are trying to reduce your weight, whether with PCOS or any other condition, have a target. So minimum target would be at least to lose 500 grams per week, right? අඩුම තරමේ ග්‍රෑම් 500ක් සතියකට අඩු කරනවා කියලා ටාගට් එක තියාගන්න. ටාගට් එකක් නැතුව වැඩ කරන්න බෑ. weighing scale එකක් ගන්න. ඒක තියාගෙන ටාගට් කරගෙන යන්න. And make sure when you are weighing your scale, weigh at the same time. So PCOS, we treat, other than the diet and exercise, we treat depending on your key problem. Let's say your key problem is not having a baby, then we will give you pills to have a baby, to have an ova and baby. But if your key problem is you are schooling and you have problems with irregular, unpredictable periods, yes, we would put you on a pill, which we called, commonly we call it pill. These are combined hormone pills, just to regulate your cycle. This will regularize it, and bleeding will be less, pain will be less, right? So there, it has a lot of advantages, and it has some protection over endometrial cancer. So we would put you on a pill if it is necessary, and we might give some pills to minimize the bleeding, and depending on the condition. So if your main problem is acne, management would be a little different. If your main problem is having excess hair, management would be different. If your main problem is losing hair, management problem would be different. So depending on the condition, the rest of the management would be different. But remember, diet and exercise for everyone. Yes. So this, the pink tax, right? Just I put to give you an insight about it. So this is a campaign which came to say to minimize the pink tax, to minimize the tax on sanitary napkins. So when you select sanitary napkins, find something which is comfortable for you. You don't have to make menstruation a pain, right? So use something comfortable for you. Don't try to go behind these myths and taboos and make your life miserable, right? So there are good products, and there are products, the menstruation pad, the pads and these things has been used over now close to century. So they have not caused any problem, right? There are any associated complication of using pads. So be wise and make your selection. Yes, so we'll just briefly touch upon this thing. I'm not going to talk in great detail about this condition. So this is something we call endometriosis. So this is a condition where now I told you this is the inner lining of the womb. When you menstruate, it will come down out from the vagina. But in some people, we have noticed some blood goes from these tubes and fall them into the abdomen or the tummy inside, right? So what happens, along with the blood, this inner lining, cells in the inner lining will also go out, and they will be deposited in the tummy. So what happens in the next cycle, these cells will start to bleed, right? They will be planted here, and then next cycle they will bleed from here. So these are the sites where these cells can go, right? So these ones, red, see, they are on the ovary, they can be on the tube, they can be in the on the inside the tummy. And if you have done a surgery, during the surgery, they can go here and there. They can be outside wall of the bowel, right? So gut epithelium. So next cycle, you will have bleeding from there. So what happens to that blood? Can they go out? No, there's no way that it can go out. It will be collected there and it will be very painful, right? Very painful. And when the bleeding stops, it will be sticky like glue and it will stuck or adhere different things. So let's imagine there's blood coming from here. That blood can't go anywhere. When the cycle is over, it will something like glue. What will happen? The ovary will be plastered onto the uterine wall. The ovary will be plastered into the tube. So it would be something stuck, like glued together. It is painful, and if you have it, might make it difficult to have babies. So what are the signs and symptoms? There will be severe cramps, right? Severe cramps, painful. Heavy period is not a very common thing. The pain is common, and pain can be in the pelvis, in the back. And if you have sex, it could be painful during sexual intercourse. And if you have things over in your bladder and bowel, so going into the toilet would be painful during menstruation, and urinating, peeing would be difficult during menstruation and can lead to infertility. That means not having babies. So this is ultrasound scan photo showing collection of blood in the ovary, which we call it chocolate cyst. Chocolate because when you operate, the blood collected inside, after some time, the blood has the appearance of chocolate, just like melted chocolate, right? So that's why we call them chocolate cysts. So this is the laparoscopy. When we put a camera and see in the tummy, that we can see this kind of collected cyst. We call it cyst. So everything is plastered together. So what can we do? Now, endometriosis is not something you can tackle with food and exercise, right? It needs more aggressive management. So if you have the classically, I told you, if your menstrual pain lasts after the completion of menstruation, if it outlasts menstruation, that can be a sign of endometriosis. Can be, not always. It can be a sign of endometriosis. So then visit a doctor and get your scans done. And if we find you have it, we will offer you surgery to correct, not to correct, but to remove those blood collections, right? But we can't prevent it happening, right? To prevent it repetitive happening, we will put you in sometimes in pills and injections to make sure you don't have your normal cycles. Because if you menstruate, you can bleed outside. So to prevent that, all what we can do is preventing menstruation. So the management is difficult and it should not be taken without consultation of a doctor. So these are some common methods, right? I don't know whether you are aware. These are called tampons, right? It's very commonly used in other countries. So it's something made with cotton, which can be inserted into the vagina. So you don't have the hassle of wearing a sanitary napkin on your underwear. You can just put it, and when it's full, it will absorb blood, and you can just it's like taking the plug out and remove it, and it's very convenient. Initially, when you start wearing it, you might feel like something is there inside, but you will get used to it commonly. So I know there are different sanitary napkin bands, they come in sizes, the heavy flow, normal flow, dry layers. So find something comfortable for you. So this is a gadget called menstrual cup. Again, the advantage of cup is it's reusable, right? It's made with some silastic rubber. So initial charge would be high, but after that you can reuse it. So you don't have to spend thousands and thousands over sanitary napkins. You can just use one menstrual cup. But if you are not very happy to remove your own blood-filled menstrual cup, then it might not be the method for you. But if you can get used to it, it would be very cost-effective. But sometimes you will be worried because whether there will be bleeding from the cup, whether there will be spilling from the cup. So you might need some extra protection. It's available most of the time, not over the market, but you can get them order online and get them down if you like to use it. So then we come to the last subtopic. Anyone know what this is? What is this orange color coronavirus-like thing? It's like the coronavirus, right? Anyone? What is this? Are you all listening? No, this is not a lecture, right? Just a discussion. So I believe you're here because you want to join the conversation. Any wild guess what this is? The coronavirus-like thing? No? It's a virus.
HPV?
Very good, very good. So it is HPV, the human papilloma virus. And here is the neck of the womb, right? It's a 3D animated photography. So this is the womb. Here is the ovary. And this is the fallopian tube. See, this is the neck of the womb. The neck of the womb is sick. See the yellow color thing, it's a growing cancer here. It is sick. It is sick because of this HPV, the human papilloma virus. We'll see how it happens. So human papilloma virus is a DNA virus, right? So it's a DNA virus. It can, it's not always a sexually transmitted virus, right? It can transmit from just by touch, a kiss, a hug, anything. And there are so many subtypes of this virus. Then, wala coronavirus එක දන්නවනේ. දැන් ඒකේ COVID-19 කියන virus එකේ තියෙනවනේ alpha, delta, kappa, lambda, delta plus, right? You are very familiar with all these virus types. So the human papilloma virus also similarly has different subtypes. So the HPV subtypes, we have not given Greek letters, we have given just numbers. So 11, 13, 16, 15, 33, 34, 35, likewise, the numbers are there. So there are so many subtypes. So out of these subtypes, there are some subtypes which can cause you viral warts. We call warts in the face, right? So this is just in the face. So this is a viral wart in the face. That is because of some subtypes of HPV. And sometimes they can cause warts in the genital region, right? In both male and female. Anogenital region, the anal region and the genital region, see? So it can be found in the penis, it can be in the vagina, vulva, and anus and cervix, right? It's not only in the neck or the cervix. So it can be in the orolabial region and also the anogenital region. So how do we prevent it? So this is one way to prevent it. So we can't prevent the oral one by this, but we can prevent the anogenital one, spreading this, the HPV by the condom. So ideal way to prevent a genital infection going on is to not to have too many partners, just to be with a single partner. But in practical life, we have seen it does not happen that way. So one thing that we can do here is put a cover, right? Put a cover. So you don't transmit your viruses to the other one, and you are not taking that one's viruses either. So that's a very important thing, a simple thing which can prevent lots of infection, not only HPV, but more important sexually transmitted infections like HIV, gonorrhea, chlamydia, and trichomonas. So other things can be prevented by this simple gadget, right? Very cheap. You can take it something for about 70, 80 rupees. And if you go just to the MOH clinic, you will be offered free of charge, right? And there are some condom vending machines now in Colombo. I know some of you are from Colombo. So there are vending machines, right? You can just put some money and take the condom. So that is one main method where you prevent the HPV coming into your body. It's like wearing the helmet when you're going on the road, right? So you protect your head by wearing the helmet. And then now this is show what can the HPV do. So not all HPV infection will be ended up having cancers in the cervix or the neck of the womb, right? So most of the HPV viruses will be cleared from your own immune system in the body, right? So we have a battalion to combat this virus. So we will kill the virus and it will be taken away from the body. But sometimes we can't fight it. And sometimes if you are having repetitive, you fight and send away, another one comes, you fight it away, another one comes. So if you have repetitive attacks, like with HPV, and if the HPV is going to sit there for a long time in the neck of the womb, it can make it to a cancer, which we call the cervical cancer, because the HPV is a DNA virus, right? We have DNA in our cells. So it can attack our DNA and cause the cells to go wild and grow into a cancer. So this is another way to combat this problem. This is like having insurance, right? The pap test. You may have heard about it. ඔයාලගේ අම්මලා එහෙම යනවා ඇති සමහර වෙලාවට පෞල් සෞඛ්‍ය සංවිධානයෙන් කියලා ගමේ ක්ලිනික් කියලා අපි කියන්නේ MOH ක්ලිනික් එකකින් කියලා අහලා ඇති. ගැප් ගෙල පිළිකාව නවත්තන්න ඔයගොල්ලෝගේ ගැප් ගෙල ටෙස්ට් එක කරගන්න. එහෙම කියලා කියනවා අහලා ඇති. announce කරලා යනවා එන්න කියනවා pap test කරන්න. So you may be familiar with this. We call it a pap test. It's a very simple test, so you can see. So we in the clinic, so we put a very small instrument and take a sample. The sample is not painful. You might be a little uncomfortable, but we use something called IR spatula, a small wooden rod, like the popsicle stick. You remember the popsicle stick? Or some tiny wooden rod like that, and take a sample. And from that sample, we can see whether the neck of the womb is getting any changes due to HPV. So we offer this to adults after the age of 35, right? So 5 yearly, ideally we have to do 5 yearly from 35 until the age of 65. But at least we encourage women to have 1 or 2 in their life. So it's like having insurance, right? You meet with the accident, but still, because you have the full option cover, so we find there's some problem, although the infection has come, and we can take measures to mitigate that, right? We can just cut that initial part and take away if there are any changes. So it will not grow into a cancer. So this is the most important thing, right? The HPV vaccine. So it's not like having the helmet or having the insurance. It's like when you go in the road, you have some invisible shield to cover you, like having invisible shield. So the HPV vaccine. So when you introduced with the COVID vaccine, I know there were so many questions asked about the COVID vaccine, but the HPV vaccine, yes, it was introduced a few years back, but we know it has been taken up very very significantly. It's very good. So I don't know whether you have received this already, because we introduced in, yeah, I think you have. Are you all being vaccinated? Have you been vaccinated against this one? Have you had your dose?
Madam, this was introduced after we passed out from the school.
Oh, okay, okay. So you missed it, right? So don't worry, maybe you can still have it. So we introduced somewhere in 2016 or 17. So to the grade 6 children. So this is, you can have 2 doses, right? 6 months apart, 2 doses. And it has about 70% coverage, right? 70%. Why 70%? Why not 100%? Is, I told you, there are so many subtypes. So in our vaccine, we usually give you 2 subtypes covering the cancer and 2 subtypes covering those spots. So there are so many other subtypes, and the vaccine coverage is also not 100%, but it has about 70% coverage. So because it's 70%, just because you got the vaccine does not mean you can skip your pap test and you can skip your condom, right? Always remember the condom and the pap test, because there's 70% cover from here and you can have the other 30% from the condom and the pap test. So this is a leaflet given from the Family Health Bureau for the promotion of HPV vaccine. So it has good instructions about it. So see, it's about 70%. No, that's about major subtypes. So there are 4 subtypes there. We give quadrivalent vaccine. So there are 2 doses given 6 months apart. And if you have not had your vaccine from the EPI schedule, the extended immunization schedule, you can still have it, given the fact that you have not been exposed to HPV. That means if you have not had sex yet, right, penetrative sex yet, you are still a candidate for HPV vaccine. So the upper age limit is 45. So until that, you can have the vaccine, right? But once you have had sex, you have been exposed to HPV, so the vaccine is useless, right? Vaccine is not given. So see, we spend a lot on the vaccines, right? The government. So each year we have been adding new vaccines, right? You know, from the birth you have been given vaccines from BCG until the last rubella, so many vaccines. So we add better ones, right? The OPV is changed to IPV. So better vaccines are being given. So initially when we were small, we had triple vaccine, triple-like. Now we give pentavalent, and soon if we have money, we'll be moving to hexavalent, right? Then HPV is introduced, and after a few years, I'm pretty sure there will be Pfizer or Coax or Sinopharm, someone coming with the COVID-19 cover, right, in this routine schedule. Okay, so with this, I would like to stop this presentation. So I put this to show how proudly these women menstruated, right? I know these two, the magnificent pictures are from this Kalani Vihara. So you see in this one, it's the Hemamala, Princess Hemamala and the Prince Danta. So they came for so many months, right? They traveled across countries for so many months, having the tooth relic on Hemamala's hair, right? So she was menstruating every month. It doesn't say in the history that she never menstruated, so we have to assume that she was menstruating over a month, every month, right? And she was carrying that important, precious relic. And here you see the Honorable Sangamitha bringing the Sri Mahabodhi. So it's a very, again, a journey which would definitely may have taken for more than a month, right? May have been taking several months. So, right? So remember, these are very heroic women who has brought very important things to our country, right? So don't let menstruation hinder your life, right? Take it as a proud thing and make wise decisions and make your life comfortable and bleed proudly. That's the message I have to give you. Okay, shall we go to the questions now?
Yeah, thank you very much, madam. It was very informative, and we were able to get clear idea about the female reproductive system, basically the anatomical and physiological aspects. And the talk about the abnormalities was really most needed one. Thank you very much, ma'am. Okay, so with that, we'll go ahead to the questions. Okay, so we have sorted them out. The questions. These are the questions we got about the irregular periods.
Okay.
I have irregular periods, and when my periods comes, it lasts for 3 days with thick brown reddish blood. Then I haven't had my periods in 2 months. I have an itch and often urinate. Should I consult a doctor? And I haven't had my periods in 6 months, and my family doctor says I will be okay soon, but I am worried. Then I had dengue fever last month, and they said I would get my next menstruation earlier, but it took 10 days more for next menstruation. It means 40 days from last menstruation starting date. Is this normal for a normal condition after such an illness, or something to take care about?
Okay.
Can you explain?
Yes. So for the delay in periods, when you start having your cycles, right, soon after your menarche, now I told you there will be release of 1 ova per cycle, right, after maturation. So most of you will not have these 9 cyclical regulated cycles in the first 2 to 3 years in your reproductive life. That means soon after menarche. ඔයගොල්ලෝ attend වෙලා අවුරුදු 3ක් විතර යනකම් ඔය cycles හරියට එන්නේ නැහැ. So සමහර වෙලාවට ළමයි attend වෙනවා, but for about 6 months you will not have another cycle. It is common and it is normal, right? Because it takes some time to establish regular cycles. So in the first 2 to 3 years after menarche, if you don't have regular cycles, don't worry about it. But if you have other features of PCO and something, yes, then it's time to visit a doctor. But otherwise, you can just ignore it because it's normal, especially in the first 2 years. But if you have had nicely regular cycles, and all of a sudden, if it disrupt in the middle, so disruption can be for so many reasons. So as in this third one, so any illness, right? Like not only dengue, any illness. Or any stressful event, like you had a death of a loved one, right? Or you met with a serious accident, or some kind of a stressful event, or maybe a special milestone in your life, like your exam, or you change your place of living. So things like that can affect that. I told you the FSH and LH is coming from your brain, right? So your mentality, your trauma, psychological stress can affect these hormone secretions. So it can be irregular, it can be earlier than expected, or late than expected, sudden events. So when you have that kind of a sudden events, once in a while, right? Not for 6 months, but maybe 2 or 3 cycles can be irregular, and it can happen earlier than expected or later than expected. It is normal. It's natural. That happens because of the disruption of your cycle, hormonal cycle. But if you keep getting this problem for more than 6 months, right? So you have infrequent period happening less frequently than 38 days or earlier than 24 days, or the regularity is disrupted, so shortest to longest cycle gap is more than 7 days, then you should consult a doctor, visit a doctor and see what is the reason. Right? So the color of the blood is not, we are not very much concerned. So if the irregularity is more than what I told you just now, then you should visit a doctor, right? So having itch or with urinating is not related to your menstruation. It can be something, infection going on your with your urine, or it may be something related to your underwears, allergic condition or something like that. Yes, so if it is troublesome, you should visit a doctor. Regarding the periods, yes, so that is the time gap, right? Remember the time, what is normal. Okay, good. Shall we move? Have I answered the question?
Yeah, okay, we have the next question. How does malnutrition affect the menstrual cycle?
Yes, so as I just mentioned, so the FSH and LH is coming from the brain, and to keep it regular, there's another one coming from the hypothalamus called GnRH. So the malnutrition has that you will have less fat in your body. So you need some amount of fat to give these, to have the brain to have these hormones regulated and have in a cyclical fashion. The fat tissue is not is a useless tissue. It is a very active endocrine organ. It secretes some hormones, right? There are different hormones, things like leptin, and which act on the brain. There are a lot of chemical pathways. So these signals are necessary for the hypothalamus to secrete GnRH. So when you are malnourished, when you don't have enough fat stores, or when you do too much exercise, like vigorous exercise for so many years, that can affect on your menstrual cycle. That is through action on the hormones in hypothalamus.
Okay. Is it next one is it okay to do intense exercise during and after ovulation?
Yeah, it doesn't have any problem with ovulation is not affected, right? So intense exercise during a period is not a problem. But as I just told you, if you are doing strenuous exercise over the years, like if you are an athlete, right? Let's say you are an athlete competing for national level, or you are a sportsman at that level, right? Not just school team, right? If you are doing that much strenuous exercise every day, about 5-6 hours of vigorous exercise, 365 days, right? Then your cycles, if you have not achieved menarche, yes, it can get delayed a little bit, and then your cycles can be prolonged and delayed. That because of the hypothalamic axis disruption. That is for that level, right? Athletes. So that is a problem that we tackle with athletes, the national levels, right? Not for just for sports, right? If you want to do sports, don't get your menstruation come in the middle and disturb your sport. Go ahead with it.
Okay. Next one is, can nutrient imbalance caused by menstruation cause excess hair loss?
It's like this. Now, if you have too much bleeding, iron stores can get depleted, and the iron stores, low iron stores, can cause loss of hair. So yes, so it's rather than it's not, then you have to remember it's not normal menstruation, right? So normal level of menstruation, that means your hemoglobin is not too low. So if it goes to a level where you need iron therapy, that means you are bleeding too much, right? So yes, excess menstruation or heavy bleeding can cause, yes.
Next one is, can exercise and dietary changes help overcome irregular periods?
I think I have answered that question, right? So if it is due to PCO, obviously answer is diet and exercise. Good.
And next one is, why are there many cases of women not being able to have children these days?
Okay, so first I would like to correct the question. It's not women who don't have children, right? It's couples who would not have children. It's couples. Don't put the blame on the woman, please. Yes. So this asks these days, right? So that means you have a baseline value to say these were the fertility rates about 20 years or 50 years ago. At best of my knowledge, we don't have such statistics in our health sector, not in our country, to say these were the fertility rates 50 years ago. You understand, right? Fertility rate is the amount of the chance of a woman having a baby. So we don't have our statistic to say these were the fertility rates 50 years ago. These are the fertility rates right now. So there's a decline in fertility rates, right? But if you're talking about the growth rates, so population growth rate, that means the rate of growth of the population is reducing. That is mainly because the number of babies born is reduced compared to 50 years ago. So 50 years ago, the one couple would have 10 kids, right? Now one couple would have about 2 kids. So the population growth rate has reduced mainly because of that reason. But we don't know about the fertility rates. So we can't 100% say the fertility rates have reduced at present. But I assume if you think it's reduced, one main reason would be the advancement of the age of marriage and age of having kids. So earlier, the average age where the woman would have kids was in somewhere in 20s, right? 19 to 20, about 50 years ago. But now that age has come to 25 to 26, right? So soon it would go. So the more that women focus on the career and the education, the age of having a baby is going up, right? So when you're 35 plus, your fertility rates start to decline very rapidly, 35 plus, right? So that can be one reason, but I don't know, because we don't have 50 years back ones. How to deal with premenstrual stress? Okay. Yes, so premenstrual stress, I told you, so it's a common thing. So you get irritability, bloated up, mild pain, insomnia, those things. So one thing is to accept it as part and parcel of your normal life, right? So accept it, embrace it to your life, right? Okay, now, so when you feel this and you remember, okay, now I'm going to have my menstruation, I'm a little bit irritable. So you can say, okay, I'm a little bit irritable today. Please excuse me. I'm just about to have menstruation. So likewise, you can accept it and live with it. So we call it cognitive behavioral therapy. We change your behavior after accepting it. That is the best way, right? Most of the time, premenstrual stress is bearable and it can be tolerated. And if you are ready to accept it, it's not very difficult. But if it is not happening or if it is not enough, then we can support with different kind of pills, right? So there are hormone pills and there are antidepressants. So if you think it's too much and unbearable and you need help, visit a doctor. We have some medications to help you.
Okay, the next one is, can you get a full recovery from PCOS with just a few months of medication and lifestyle changes?
First, I'll tell you about the lifestyle changes, right? Now let's say you had PCO diagnosed and then you were offered those lifestyle changes, right? Diet and exercise. And if you maintain those lifestyle, not that you reduce the weight and then forget about it and keep on eating all these sugars and fats and this and that, right? But if you try to maintain that over a period or over your whole life, then you will be able to maintain, right? Maintain the same pattern. If you maintain your lifestyle changes, the same pattern, yes, you can suppress it and maintain. But the medication, so if you are not using the diet and exercise, but only using the medication to support you, The moment you stop your medication, it can recur, right? So you just put a pill without losing your weight, or without doing the diet control, without correcting those things. If you depend yourself on a pill, pill will not correct it. Pill will only control it. So if you need correction, go for the lifestyle changes.
Okay. Next one is, can the hymen be affected without any sexual activity?
Highly unlikely. Highly unlikely. We have never come across such situation. Because, you know, it's just, I showed you, right? It's at the vaginal orifice, right? Until something is pushed in from the vaginal orifice, it's unlikely to damage it. So if you are thinking of putting something in, something very similar to a erected hard penis, yes, you can get it damaged. Otherwise, by a parting legs or doing exercise, gymnastic, karate, this and that, it will not be affected, because it's not between your legs to affected by parting legs. It's inside the vagina.
Okay. The next one is, does PCOS cause excess sexual feelings in young girls?
That's a tricky question. Well, young girls anyway have sexual feelings. You don't have to put the blame on PCOS, right? It's very natural. So other than that, we have not come across excess sexual feelings as a problem associated with PCOS. But theoretically, as there's some androgen excess in the body, extra androgens are there. Extra androgens gives the drive, sexual drive. So it can theoretically cause a little bit extra sexual feelings. But I have not come across that in patients or complaint or literature. I have never seen it. Theoretically, yes. But what I have to say is, don't put the blame on the PCOS. It's normal, right? It's normal.
There's a personal question like thing here regarding endometriosis. I'm 26 years old and single. My periods are very irregular, sometimes 2 months bleeding, sometimes 3 months without bleeding, no pain, but have some blood parts like pieces, but I don't have any symptoms. Doctors told it is okay and no pimples, no excess hair loss. I met POG many times and did scans. They recommended me a tablet for 21 days and other rest of 7 days for bleeding. But for those 7 days, I don't have periods. I took medicines for about 1 year, but it is not okay yet. What can I do?
Yes, so that is actually because now already doctors have seen and this thing, so it's kind of difficult to give a straightforward yes or no answer for this kind of question without going through the records, right? Because it's a very individualized question. So we need to see the patient and we need to see the records before we are going ahead with the next level of management, because the diagnosis of PCOS, first we need to establish it. And if it is true PCOS, then we can start on a pill like mithuripil, where we can continue it for about 1 to 2 years even. But I think this girl might need some hormone checks before that, because she's been already been treated and she doesn't seem to have other features of PCO. It's just irregular periods. So the thyroid problems and other hormonal imbalances can cause similar patterns. So I would advise you to visit your gynecologist, right, and follow up and get your problem sorted. If you are around, you can visit Ratnapura Hospital. So we might be able to help you.
Yeah. Okay. Next one is, does removing one ovary affect the chances of having a baby?
Yes, true. It can affect because it is when you get the reservoir. So the reservoir, the ovaries are the reservoirs of ova, right? So 50% of the reservoir is affected now. So chances are reduced, but it doesn't necessarily say your fertility is reduced by 50%, because when the one ovary is functioning, that ovary will keep on producing ova every month. If that until that ovary goes out of ova, right? So ovaries have enough ova to produce. So it doesn't necessarily mean you will have reduction in fertility by 50%. Yes, some it can affect. So if you are going to delay your pregnancy too much after one ovary having removed, then it can affect it, right? So there can be reduction, but it doesn't make you subfertile, right?
Okay, next one is HPV vaccine for both males and females?
At the moment, we don't recommend for males. We only offer for females, right? But in some other countries, some trials are going on to offer it to the teenage males also, because some, especially when there's homosexual, in between the homosexuals, the risk of HPV related anal cancers and penile cancers can be reduced by the HPV vaccine. In our population, because the population of the unisex relationships, the homosexual relationships are not very common at the moment, we do not offer.
Next one is, what are the bad effects of using tampons and menstrual cups? Does using them affect fertility?
Well, the first question, none of the sanitary methods, right? Tampons, pads, cups, or whatsoever, none affect the fertility, right? Then the tampons and cups, they are very safe methods if you know how to use it, right? So you know there's a knife at your home, right? So you can cut your bread from the knife and you can cut the finger also. Just because it can cut your finger, you don't blame the knife and stop cutting your bread, right? So it's like this. So if you don't use it in the proper way, if you don't change it, if you keep on the same tampon and the same cup for a long time, maybe 24 hours plus, right? Then some bacteria can grow in there because it's a very good culture medium and lead to some infections and things like toxic shock syndrome, right? That happens when you don't change it on the time that you have to change it. But if you take care of it, it's just like the knife in your home, in the kitchen, right? So it's up to you to decide whether you cut the bread or you cut your finger.
Okay. There's another question. A person I know took Aldactone to reduce her pimples. Now she is having trouble with irregular periods. Would the irregularity stop when she stops taking the tablet, or is this effect long term?
Yes, so Aldactone is mainly, it's given to treat acne sometimes and to hair loss. It's not a recommended usage. It's just a it's a common usage, but not approved one. Aldactone is spironolactone. It is mainly given to control blood pressure. So it acts by blocking androgen receptors. So that can actually lead to irregularity of periods. So if your problem came, the initial problem of having extra acne was associated with PCO, just by stopping the drug, irregularity will not be reverted to normal, right? But if your acne was not related to PCO, it just came on its own, and then stopping on the drug should cure your problem. But anyway, we don't recommend those drugs to be used for a long term, right? Those are not over-the-counter drugs. So you take for the minimum period and don't use it for a long time, because you can have losing of potassium that is more devastating than having irregular periods, right?
Okay. How can I get into gynecology and obstetrics?
Okay, I assume this is from a medical student. Good. So what you have to do is you finish your finals, right? So any PG, this is how to do postgrads. So once you have finished your final year exams, MBBS, then you will have your internship as intern house officers in hospitals. So this is a 1 year period. There are 6 months or 2 appointments. So one appointment would be either medicine or pediatrics, and one appointment would be surgery and gyneops. So first thing, if you are planning to do gyneops, select gyneops as 6 months part of your internship. So once your internship is over, after 1 year post-intern, right? 1 year post-intern, you are eligible to sit selection examination in obstetrics and gynecologist. Selection exam. Not only ONG, after 1 year of post-intern, you will be eligible to sit any postgraduate exam, surgery, medicine, ped, anesthesia, dermatology, rheumatology, this and that, so many things are there. So during that post-intern 1 year, you have to study for the selection exam, right? It's a very difficult exam. Our one, we only have once a year. It's a very competitive one. So study and then get through the selection exam. So we have about, at the moment, PGIM enrolls about 30 registrars per year, right? Per annum, only about 30. So 25 is coming from the Ministry of Health, 5 from the Ministry of Higher Education and Defense. So these 30 will be enrolled in the postgraduate training as gynecology and obstetrics registrars. So that's how you get enrolled. And there's a 3-year period of registrar training. And once you complete the 3-year training as registrars, there will be MD exam, which is a very difficult exam, something similar to your finals, but very tough. There will be foreign examiners coming. And then once you get through your MD, there's 1 year local training in the country, and there's 1 year compulsory foreign training. So after that, you will get your board certification as a consultant obstetrician and gynecologist. Okay.
There's a question in the chat box also. What is the best period to have babies?
Well, that actually is up to you to decide, not me to decide. As an obstetrician, my answer would be you should be reproductively and mentally mature enough to handle a baby, because it's not bearing of the baby. So your body has to be supported enough, but your mind has to be supported enough, and you socially has to be supported enough and financially. Because having baby just not end when the baby is born. It's a lifetime responsibility. Having a child is a lifetime responsibility. So to grow the child, put them to schools, and then their commitments, this and that, it's a lifetime commitment. So do it when you are ready for it, when you are stable. So when you have a job, income, right? Stable income, stable relationship. And when you are free to have a child, so you will not miss ayyo mata party at yanna bari una nare nang enjoy karna me lamai ek mata ekataවත් yanna bෑ, I never enjoyed my life කියලා හිතෙන්නේ නැති කාලෙක, right? But don't delay it too much, because I told you after 35 your fertility rate is going to decline very fast. So before 35, once you feel you can.
There's another question. I don't eat meat. What can I have as a compensation, and how many times should I have it to prevent muscle wasting?
Well, I would tell you now, there are vegetarian proteins, right? But there are things called essential proteins. So there are essential proteins. That means there are some component of the protein which we need, because we can't make them new in our body. There are some amino acids. Proteins are made with amino acids. There are some amino acids which cannot be made inside the human body. So these amino acids come only from animal sources, right? Only from animal sources. They are not coming from vegetables, not from plant sources. So minimally you can have some milk to compensate for these ones. Otherwise, but the plant origin proteins are there, like soybeans and dal, and there are a lot of other food rich in proteins, especially the cereals and pulses and legumes, those things. Then the thing is, they are not very not rapidly absorbed into the body as the animal protein. So you need to take them in a lot of quantities, take definitely 3 times, and take some extra, right? If you're going to just to have 1 gram of fish to take the same amount of protein, you will need at least 20 gram of dal, something like that, right? So, and have some milk at least. So it would compensate for those proteins.
What is the reason for having vaginal fluid like white gel?
Yes, it is because you are a woman in your reproductive life. It is something physiological, natural. So egg yolk like whitish discharge is a very normal thing. Happen mainly in the follicular phase, and some secretory phase you will have little different kind of discharge. So it's a normal thing.
And does psychology and reproduction have a connection?
Oh, definitely. That is, I told you, it's the main signals comes from the hypothalamus, right? So hypothalamus is in the brain. So what you think and what you feel, your emotions, your stresses, and your happiness and depression, they all can affect your menstruation and all the reproduction, right? It can happen. It can affect.
Then there's another one. Why I feel very pain and vomitish in the first day of period. The reason.
Yes, that is because you are having little extra premenstrual symptoms, right? So sometimes you can have little extra feelings. So if it is comfortable to you, you can have something like paracetamol to alleviate your pain, right? And then if it is not settling with those things, simple remedies, you can visit a gynecologist and we can give some extra support. It's a normal thing. Some people have little extra things, little bit abnormal.
I have got a serious vaginal itch after periods. I don't understand why.
Okay, so vaginal itch following periods could be due to many things, right? Sometimes maybe you have allergy to your sanitary napkins, whatever the brand you use, and maybe that's because sometimes they are not very comfortable. Some the brands, they have little not cotton, they have this plastic kind of material, so it can be irritable. So after you have sanitary napkins, especially if you don't remove it and change it frequently, and if you have for so many days, they can be itchy because of this allergic dermatitis kind of things. And that is the commonest reason why you have post-menstrual itch. If it is not the case, then we have to look for the reasons, like whether you have candidiasis or whether there are any other infection that we have to examine and see.
Does pills used to stop periods have long-term issues which cause infertility?
No, it doesn't cause infertility, right? That is a clear-cut answer. It doesn't cause infertility. The soon you stop the pill, the fertility will be back to normal, right? It's a common myth that contraceptive, the pill has any effect on the fertility. It doesn't. Regarding the other part of the question, whether it has long-term effects, it can have effects during the use, right? Something like, because it has estrogen, it can cause your blood to clot more frequently. And these clots can cause, if you are about 40 to 50 years, then it can have problems like heart attacks, strokes, and sometimes people get liver problems and migraines. But most of these complications are very uncommon in young people, because these problems comes with aged people. So that's why we don't use the pill commonly in 40s and 50s, right? We use them on 20s and 30s people. And very rarely, because it has some estrogen, it can promote estrogen related breast cancers. Very rarely, small minute percentage, right? But it goes away once you stop the pill, right? It will not be carried over when you stop the pill. And you have to remember these effects comes with natural estrogen also.
Having paracetamol during every first day of menstruation, whether it's good or bad?
Well, it's okay, right? It's okay. If you get one PCM tablet once a month, it will not kill your liver, right? Liver is the one which handle the paracetamol, right? So once one tablet means 1 gram, right? 2 tablets per month, it's okay by the liver. So liver can handle it. Don't worry.
I would like to ask something regarding the periods. Last time, though I bled, it wasn't red, but the whole it wasn't red, but the whole 5 days it was black and didn't even bleed at all. And then after 2 weeks, I had another brownish discharge. Is this something to worry? And this is the first time it happened.
Don't worry. Sometimes it can be a little bit irregular here and there. So if it is just 1 cycle or 2 cycle, don't worry. Things like that are normal and can happen here and there. But if it persists for more than 6 months, then yes. Doctors in psychology
field can treat reproductive problems.
I don't think so, because reproductive problems, most of the time, right? I told you that it can have some psychological impact, right? But the most of the problems, when we want to treat it, we can't treat from the psychological aspect and get them reverted to normal, right? Most of the time we can treat it the other way. But some things, right? Some things may need psychiatric assessment and support of the psychiatric team. It's like, there are sometimes we have come across patients where they believe they are pregnant, but they are not pregnant, right? We call it pseudo pregnancy, right? Because of the social pressure, not having kids for a long time, things like that, ended up them to believe that they are pregnant, but they are not actually pregnant. So in that kind of matters, yes, we need the support from psychiatric teams. But other than that, these menstrual irregularities, not having kids, those things are difficult to be treated by the psychiatrist.
Hope we have covered all your questions, and thank you very much, madam, for sharing your knowledge with us, and we are truly grateful and privileged to have you here as the resource person. And it's time to wrap up today's session, so I invite Rotaract Limtiya Izzath to end the session with the vote of thanks.
Thank you, Hasna, and thank you for handing it over. So, respected Dr. Oshadhi Nallperuma and our most valued audience, invited guests, ladies and gentlemen, it's my privilege to deliver the vote of thanks for this morning. I, on behalf of the Rotaract Club of Colombo West, Medical Faculty of Sabaragamuwa, University of Sri Lanka, and the entire team of Saubhagya here today together, and on my behalf as well, extend a very hearty vote of thanks to Dr. Oshadhi for gracing the occasion amongst her terribly tight schedule to speak to our audience and solve the many burning Q&As for those here today. Approaching sexual and reproductive health and rights in such a sensitive and comforting manner, and presenting the state of our anatomy so candidly, such as you did today, is very necessary for all classrooms across Sri Lanka. My lack of knowledge on certain areas that you spoke of, or the confidence that I gained after you said bleed proudly, it all proved the need for comprehensive sexuality education for the youth of our country, as this could prove to be life-altering information. I would also like to take this opportunity to place on record our hearty thanks to Maljan, Malka, Gayangi, Tamina, and Sohani, as well as our volunteer teams from both the clubs for the tireless efforts and willingness spanning over the months that they have put in to make this first phase of Saubhagya a success, with close to 160 participants throughout the session. Finally, a massive thank you to you, Our wonderful audience who made it here on a Saturday morning, abandoning the comforts of the current sweater weather to enrich your knowledge on SRHR or sexual and reproductive health and rights, including the lovely interactors present from the West family and beyond, Rotaractors from fellow clubs, and distinguished Rotarians present, without whom none of this would have been possible. I hope you have a wonderful weekend ahead, and may the force be with you.
Yeah, thank you everyone for joining with us, and we appreciate your being here. Thank you.